it gives me a privilege to have the opportunity to introduce to you Danny's mom, my friend, Carol Prader.
Can you hear me?
Yeah.
Well, yes, Chris in the back. Okay, great. Well, I wrote things down because those who know me know that I could just start talking. Especially if I'm talking about my son, I could talk for the next hour or so. So I'm going to try to stay focused and go through everything. But first, I just wanted to thank Dr. Duncan for coming tonight and speaking about Prader-Willi syndrome. All the research that I've done, I still learned something this evening. So, you know, we never stop learning. Not only is Dr. Duncan Danny's doctor, but Dr. Radu back here is also his doctor. And that's another thing I want to say about Brevard County. One of the best things that has happened to my family and to Danny's life is the fact that we moved here to Brevard County because of the medical care and the people that we've been dealing with. I mean, it's absolutely top-notch. And those two are definitely examples. I did want to say one thing, and I'm going to go through, I'm going to tell you a little bit about Danny today, give you, story of how everything, what I've done a lot of alternative kinds of things. I refused to accept what I was told in the beginning, and just kind of give you a chronological process to go with me and see how Danny got to where he is today. And one of the things I was going to mention too is when we first moved here, and I brought Danny to Dr. Radu, he didn't believe he had Prader-Willi syndrome. I think the same thing kind of happened when I took him to Dr. Duncan, and when I took him to a geneticist over in Orlando, same thing. They said, nah, this child doesn't have Prader-Willi syndrome. Of course, my panic is he has to have Prader-Willi syndrome, because if he doesn't, I got to start all over again and figure out what the heck is wrong with him. But anyway, I think there are reasons that Danny maybe does not present like a lot of the other children with Prader-Willi syndrome. You heard a lot of growth hormone and things like that. But there's a lot of other things that I've done. So again, thank you to our doctors, and thank you to Tony and Kate Canaveral for allowing me and my Prader-Willi syndrome to do one of the first lecture series. I'll try to keep this to around 15 minutes or so, but I would like you to interject and ask questions as I'm going through my story, and even some of the things that I've done, over the years. If it's something, especially to the families that are here, if there's something that you have a question about, please interrupt me, because I need to take a breath every once in a while. I am pleased that I'm going to be able to show you the child behind the disorder, because I think it's really, really important for everyone who deals with a child with special needs to understand that the disorder does not define the child. And one of the great things I thought tonight as I was hearing Dr. Duncan speak is he talked about children with Prader-Willi syndrome. He didn't call them Prader-Willis. It's something that just makes my skin crawl. And I used to accept it, and I don't accept it anymore. And I still hear, even the experts at Shands, there's a gentleman there, wonderful doctor, he still will call them Prader-Willis, and I won't let him get away with it. So that's one of the things that I want to make sure you understand. They're humans behind this disorder. And despite the clinical findings and everything that you read on the internet, there is always hope. And everything is a spectrum disorder. So let me tell you about Danny and where he is today. And after everything you've heard about today, Danny's 9.5 years old. He's 59 3/4 inches. And by the way, Dr. Duncan, he wants to be 5 feet tall so bad. On Monday, I'm going to recommend you just lie to him and tell him he's 5 feet. Otherwise, he's going to keep saying, "Are you sure? Are you sure?" So he's almost 5 feet tall, 104 pounds. His bone age is 12 years, 9 months. So if you can kind of picture a child who's 9 years old, but he's about the size of a 13-year-old. His BMI is 20.5%. His BMI is lower than mine, which really pisses me off. But really, so and again, think of what we're talking about here. This is a child with Prader-Willi syndrome with a BMI of 20.5%. His resting kcals, his metabolism is 1650. So that gives you an idea. He has large hands and large feet, large hands like his mom's. And he loves to shoot and make baskets, and he shoots basketball and makes the hoops, and it's like a 9-foot tall basketball hoop. So you can kind of picture this child now. He attends Gardendale Elementary. He's in a mainstream classroom, not in special ed. His latest report card was 2 A's, 2 B's, and 1 C. And we're going to work on that 1 C. He does have an aid. He has an aid that helps him focus. That's one of the things. ADD, which, again, everything we need when I'm talking about Danny, again, those who know me are going to go, yeah, that's genetic. We can see what I think. That's one of them. So that A is going to help him focus, but the A also helps with the fine motor skills. He still struggles with buttoning pants, and he still struggles with writing and things like that. And when you get to 4th grade and moving up there, that kind of becomes an issue. So he does have a full-time aide, but Lawrence County has been outstanding when it comes to that kind of thing. I think they are wonderful advocates, and and definitely if you have issues in your individual schools, going to the school system is the way. And so any of those parents who are from this area, if they ever need help, just ask me. All right. Yeah. All right. You know what? Because I will, real quick side, I did have some struggles with Gardendale in the beginning, and took charge of it, and we got, they're all good. Yeah. I will absolutely, I'll sit down with you and talk to you about a lot of things I did and what I recommend for sure. So Danny, very bright, he's engaging, very, very compassionate. He's a very old soul and very smart. And I think that those who know him would actually agree with that. We don't lock up our cupboards, our refrigerator, or our pantry, and we leave food out all over our kitchen. I have to worry about my daughter. She's the one who sneaks the candy, and I find the wrappers under things like that. Danny asks permission to eat when he's hungry. There's a lot of dislikes when it comes to food. He will push things away. And remember, he's 9 years old. And for those of you who know Prader-Willi syndrome, there's different phases that they talk about. After 6, you're supposed to be into that food-seeking phase. He's not there. Now, I think if I gave him food, he would keep eating it. Of course, there's a lot of us that are like that. A big bag of chips and I'll keep eating. But I really do think that's one of the ways that he just doesn't have that mechanism that says, stop eating, you're full. Now, if you give him something more important to do or more interesting, he can go on to that and he can forget about the food. He will actually ask to leave the table before finishing, but one of the things that I have tried to teach him is, visual cues. When your plate is empty, you're done. These are things that we should be teaching ourselves and the rest of the population sometimes, I think. So, and that's when you can step away. So it can become portion control. Put smaller portions on his plate. He sees it's finished. Now he starts thinking about things he wants to do. So that's some of the things. So does that sound like a child with Prader-Willi syndrome based on what you just heard? No. Not exactly. Exactly. Not so much. Now, I do believe that Danny presents as if he's maybe high-functioning autism, because people know something isn't right. They love him, but something isn't quite right with that child. And it's probably more like autism. And except that he's extremely social, and he can look you in the eyes, he can still kind of fade off, but he's a little more social, I think, than many children with Prader-Willi or with autism. So the big question is, why is Danny different? And first of all, I want to make sure you know that Danny has Prader-Willi syndrome by uniparental disomy. We talked about there are a couple different types you can have. Uniparental disomy, which is when you end up with the 2 copies of the mom's chromosome. From what I had read, it was trisomy rescue. Start off with 3, 1 gets kicked out. Of course, again, all of those who know me know that my chromosomes pretty much kicked my husband's chromosomes ass, and that was it. And so that's where Danny came from. So again, I'll take credit genetically for all of Danny's successes. No one's allowed to tell my husband any of this that I've said. but the thing I want to mention real quick about the uniparental disomy is I think if you start to look at kids with the deletion and with uniparental disomy, you'll see kids with deletion that are a little fair hair, blonde, their eyes have a little bit more, the shape is very similar, you'll see that. And then you'll see the kids with UPD look a little bit more like their parents. And from what I understand, chromosome 15 has a lot to do with some of your facial characteristics and things like that. So if you've got a deletion in the material, okay, that would make sense that you're kind of losing some of that. And so that's Danny's. Now, the other side of uniparental disomy is chromosome 15 has been tied sometimes to the autism gene. Say there's something, maybe a similarity there. So they'll say that kids with UPD may have a higher tendency to have this autistic tendencies. They will also say they may have more psychotic or emotional issues as well. And then again, maybe that's something to do. That's all I've kind of read up on it. So those are some of the things that we're always looking at.